Okay, everybody, I'm going to show you how to go into Medicare.gov and look up your prescription drug plans. Since it's September, it's not going to show next year's, but shortly after October starts, I will send another video out just to kind of show you the differentiation and how to make sure you get to the plans for next year. But this tutorial should help you get there anyway. On the home page of Medicare.gov, you're going to click on Find Health and Drug Plans. Your zip code goes here, 66223, let's just say, for instance. Find Plans. So now it's going to ask you, how do you get your Medicare coverage? If you have a Medicare supplement, you would want to put Original Medicare. And then it says, I also have a separate Medicare drug plan. This allows you to actually compare the alternatives to your current prescription drug plan. So now down here it asks if you're going to get any help from the state. I'm just going to say nope, I'm not on Medicaid or don't get any special assistance. If you do get special assistance, there are some searchable options, and then you could always contact us. But I'm going to move on, continue to plan results. So now it's saying, hey, which plan do you have? And you'll see that every option available in our area is here. So I'm just going to say, hey, let's just say that I have the Medicare RX Saver AARP plan. That's a United Healthcare plan. That's just an example. And go ahead and click on Continue. It's asking us, do we want to do a survey? I'm going to just say no, not for now. And now this is when you get to put in your drugs. Very important that you know the dosage and frequency of your drugs, but I'm just going to use 3 examples. Atorvastatin, most popular drug on the planet, generic Lipitor, and it defaults to the most commonly prescribed dosage and frequency of the drug. However, obviously you want to pay attention to what you're taking. I'm just going to put 20 milligrams, 30 per month. If you get it mail order, just leave it on retail because it's going to show you both retail and mail order. Add drug and dosage, and as you can see now, there's your atorvastatin. Now I'm going to go ahead and I'm going to put in metoprolol. And succinate is the more popular version. Obviously you're going to customize this to you. 50 milligrams extended release. Click on Add the Drug, and now it's there. And then I don't know, I'm going to use a Pro Air. I think that's kind of for asthma or something like that. So it helps with breathing. There's only one way you could take that. Add that drug. So now I've got 3 drugs here, and by the way, very helpful hint, a drug list ID is generated whenever we do this, whenever you're in a session. So if you ever record that and the date that you're doing it, which in this case is today, and you'll know your zip code, of course, you can always return to Medicare.gov, and then you can put this drug list ID number in, your date, and your zip code. It's going to populate all your drugs, which allows you to actually just make changes later. People who take a lot of prescriptions, you can save a lot of time by just recording this. So my drug list is complete. Now it says, hey, what pharmacy do you go to? And it gives you all the pharmacies within 1 mile of your home in this case. And if you don't find the pharmacy that you go to, you could expand the radius and find even more pharmacies. But I mean, you're going to find immediately, oh, these are the pharmacies right by my house. So I'm just going to go with the in-house that is in Deer Creek as one. It will let you choose up to 2 options. And there's the Walmart. Now, if you expand it and you said, oh, you know what, I don't go to that Walmart, I go to Walmart on 119, then that can come up if you go ahead and expand your radius. And of course there's Costco and other options too. It's not showing me the Walmart that I thought I was talking about. But it doesn't matter. We're going to move on, and I'll just choose another one. There's the Walgreens on Antioch and 151st. All right, continue to plan results. So now you will see that there are 22 different plans out there when it comes to just standalone prescription drug plans. How you would figure out the most cost-effective plan without a tool like this, I don't know. But I'm going to click on that. I'm not going to pay attention to Medicare Advantage plans for now. Click here, continue to plan results. Now, it's showing your AARP plan, which you said that you had. Of course, I said that you had. And now down here it's showing the most cost-effective plans if you were to be using those pharmacies and those were the prescriptions that you were on. It's showing the most cost-effective if someone were to start the plan from October 1st through the end of the year. In October, it's going to actually show you, it's going to give you an option up here to show all of 2018 plan options, and you would want to select that. But in this case, wow, you know, under my current plan, at $56 per month for the plan and a $400 deductible, I would be paying $426 between the plan cost, the deductible, and the co-payments for the current plan. But the Cigna plan, you're going to be all in at $268. So, you know, just for someone who is starting today, they'd be more cost effective here. And as you can see, there are several other options as you keep going. And it just gets more expensive, so there's not a ton of reasons to actually seek the more expensive plans. That shows the top 10 plans. You could actually view all of the plans or view the top 20 plans. Keep in mind that there's a star rating for these. This will tell you what the star rating means. It's really a measure of how consumers have received that plan and how they've rated it. Also, it has a compliance measure in there. But if I clicked on the Cigna plan and then also the AARP, and you click on compare plans, now it's going to show you both plans. You could put one if you wanted to, and it's only going to show you that plan. But as you can see, if I had the Cigna plan, I'm going to pay $102 the first month between the plan, the deductible, and the co-payments, and then I'm going to be paying $82 for the rest of the year. Now, how does that break down? Well, out of all of this amount, $30.20 is the premium, but the rest is your deductible and then your co-payment. So here you go, the Cigna plan. As you can see, you know, your biggest part of your expense is that Pro Air. It's not an inexpensive drug. It's $42 after you've met your deductible, and there's your atorvastatin and your other drug, your metatoprolol. Same co-payments with the AARP plan. As you see, actually the co-payments are $11 less, but because the plan actually costs more, you're not necessarily better off. And of course, you know, if you want to see what the co-payments are at different pharmacies, as you can see, your co-payments look like they go down if you have the AARP plan to $27. Still, with the premium, it's more expensive. And this will even show you, you know, what your co-payments are if you decide to go mail order. So that's a good start as to how to figure out how your drug plans are going to work, and what's going to be most cost effective for you. As you can see, this is going to be a good measurement. It's going to show you, okay, you go to Walgreens with this plan, you're paying $280 all in for the rest of this year. If you go to in-house, you're at $268. This one, you happen to be, yeah, it looks like in-house is more cost effective than Walgreens on this particular plan as well. But of course, again, this might make more sense from a premium standpoint. Once you actually have determined which plan is the most cost effective for you for 2018, then we want you to give us a call, because we can typically help you enroll in these plans. There is no application, or there's no underwriting process. You get whichever plan that you want automatically. So that is basic. That's the basic measure of how you would determine the prescription drug plan that you want. I will be creating another video once October rolls around, and you will be able to know exactly how to do this for the 2018 year. I think most of you, if you go jump into this October 1st, you're going to see that you can do it based on the instructions that you just received. Don't forget, go to Facebook and like Insurance Pros, because we want to communicate with you. Never mind all that. Look for Insurance Pros, like us on Facebook. That way we can communicate with you about annual enrollment period and other items. And I look forward to seeing you soon.